Hello, my name is Brianna Williams, and today I'm going to be performing an ear assessment. The first thing I'm going to do is inspect and palpate the external ear. And when I'm doing this, I'm going to be looking for bilaterally equal size and shape, no swelling or thickening. I'm also going to be looking at the skin condition for consistent coloration with the facial skin and no lumps or lesions. And lastly, for this portion, I'm going to be checking for tenderness by moving the pinna and pushing on the tragus, and it should feel firm, and the movement should produce no pain. Do you feel any pain?
No, ma'am. No, ma'am.
Secondly, I'm going to be inspecting the ears with an otoscope, and when doing so, I'm going to choose the largest size that'll fit into the ear canal. And when I insert it, I'm going to avoid touching the bony section in the inner ear, which can cause the patient pain. And also remembering that I will not relieve traction on the ear until I finish my exam or the otoscope has been removed. And in this portion, I'm going to pull the pinna up and back for adults and hold the otoscope upside down. And I'm going to be checking for in the external canal for redness or swelling, lesions, foreign bodies, or discharge. I'm going to also check the tympanic membrane, and the eardrum should be shiny and translucent with a pearl gray color. I'm going to check the position, which the eardrum should be flat and slightly pulled in at the center. And lastly, the TM should be intact.
Miss Nurse,
Yes.
what if you only see the ear wall? What are some things you can do to look at the tympanic membrane?
If I only see the ear wall, I can reposition the head, I can readjust my positioning or readjust my otoscope.
Thank you, ma'am.
And lastly, I'm going to test hearing acuity. And the first test I'm going to perform is the whispering voice test. And I'm going to stand 2 feet behind my patient, and he's going to cover the opposite tragus. And I'm going to move my head 1 to 2 feet from that person and whisper 3 random letters and words in his ear. And if he gets them all correct, then he has passed this test. Could you hold your left tragus for me, please? 2BK. Can you repeat it?
2BK?
MC1.
MC1?
Good. Now could you hold the opposite tragus? L3M. Pass this test. Could you hold your left tragus for me, please? 2BK. Can you repeat it?
2BK?
MC1.
MC1?
L3M.
L3M. Okay.
The next test I'm going to perform is the tuning fork test. And I'm going to vibrate this tuning fork on either my elbow or my knee. And I'm going to put it on the patient's skull, centered in the middle. And I'm going to place it on the top of the forehead and ask the patient where he hears the sound. Can you tell me where you hear the sound?
All over.
Perfect. And the normal response from a patient would be they hear the sound everywhere or in both ears. And lastly, I'm going to do the Romberg's test. And this is where we have the patient stand And the feet are going to be placed close together. The hands are also going to be placed by the side close together. And they're going to try to hold this position for 30 seconds. And what we're going to do are we're going to watch for swaying on the patient. 30 seconds. Okay. And this completes our ear assessment. Thank you for watching.